Mammograms, they're a fact of life for women over 40, or at least they should be. Today I'll get up close and very personal with Jackie Clarke, who is due her annual checkup.
Well, Jackie, I'm not sure whether it's because it's cold and I'm shaking a little bit or I'm a little bit nervous for you. Mammograms, painful.
Oh, it's no big deal. You know, like on a scale of 1 to 10, I think, you know, basically having a Brazilian is more painful. And, you know, if you've given birth, you can basically do anything. It's more a surreal experience for me because you're standing there half naked with your breast between 2 bits of perspex and a vice. And for me, that's quite humorous. Because as I get older, I'm getting more and more fabulous. You know, with that fabulousness comes the responsibility of looking after yourself. I just know that my family needs me. I want to be around for my kids. You know, you've got to really own it because you're worth it.
Now, I think you should own this walk as we walk through to the reception and just get ready to get this test underway. Because I'm not so nervous anymore.
You don't need to be nervous. It is all about you.
That's right, ladies first.
Oh.
We're whipping into Mercy Breast Clinic to meet radiologist Dr. Reddy.
How are you?
Nice to meet you.
Now you can look after this one because New Zealand love her. Well, I guess for me, I want to know is, you know, what is a mammogram and why have them?
Firstly, we are detecting tumours that are non-palpable usually, and they are much smaller when we do find them. And as a result, there's more treatment options available for them, and they haven't metastasized, so the prognosis is obviously better.
All right. It's enough talk, eh, Jack?
Yeah, let's get some non-palpable action happening.
You're not nervous, but I am.
I'm a little bit nervous.
Oh, you are now?
Well, you know, just in a good way. I can change my mind. I'm a woman.
Yeah, well, fair enough.
It's got to be done. Let's do it.
Now for the big moment. Jackie is in the good hands of radiographer Lisa Butler, who will perform the mammogram.
Thanks for the super attractive robe.
Oh, it's lovely, isn't it?
I'm loving it.
And is there anything you're concerned about now? Any problems, or is it just a routine
It's just
screening?
a routine. I'm only concerned about the amount of people in the room now.
Yes.
Other than that, it's awesome.
Yeah,
Business
it
as
doesn't
usual.
normally happen.
Don't be concerned about me. I'm support crew, buddy. I've got your back and way back.
Yeah,
too.
you're back.
Way back. Gone.
Yeah. Yeah, so,
Right,
I just
and
plonk it up there?
so
Do you
just
wanna
like
do that?
that, yes, and I'll just get you into position.
Thank you.
So like that.
Yeah.
So the compression is going to be on quite firmly. So I'm going to bring this down, and when you tell me if it's as firm as you can stand, you let me know, and I'll
Okay.
stop, and then we'll take the picture. So just let me know how you're going. So it's getting pretty firm. Are you all right?
That's fine.
She's a tough one, Lisa.
She obviously she is. And breathe away. That's great. Well done. All right. So we're going to do the same on the other side now. So we'll just get you to come off there.
While this is uncomfortable, there is no question that this is a life-saving procedure.
It's like literally a rack.
How you feeling, Jackson?
I've never felt more beautiful.
Great. And breathe away. Okay. Well, we're sort of halfway there.
It's just trying to stay still, you know, it's actually
Yeah.
quite hard. I'm a little bit nervous, my heart is racing because this is not normal, so it's just like taking a deep breath and just holding it,
Sure.
and letting it happen. I've always been good at having a photo taken, so... I hardly know you, Lisa. This is
I know.
the most action my Nork's got in ages. Oh, don't look down. That's the other trick. Just don't look at what's happening and you can sort of...
It's a bit of a weird thing, isn't it?
So weird, but...
That's good. Oh,
There you go. Well, that was my first mammogram, buddy.
I'm there for you, your first mammogram. He did really well.
Jackie's pictures will take a few days to be checked over, so we're back with Dr. Reddy, who has some examples of what she's looking for, starting with a healthy breast.
I just see a beautiful planet, or possibly Monty's head with his little ears. It's hard to even... I mean, I know that that's a nipple, but, you know, it just looks kind of spooky and beautiful, doesn't it?
Well, what you're looking at is the brighter tissue that you're looking at is all the fibroglandular tissue. The darker tissue is the fatty tissue that's you have in the breast. And here you can see these nipples are nicely in profile, and that's what it should normally look like. And while you're here, I'll show you some abnormal ones.
Okay.
So these are the most recent images, and this is the previous mammogram. And as you can straight away see, this is an example of nipple retraction, where you've got a good nipple in profile in previous imaging. And the reason for that retraction, you can also see there's an increased density in this retroareolar region, which wasn't there previously. If you compare the normal side and the abnormal side, you can see that there's a difference, and that's what we call architectural distortion. So those are two examples of things that we would be able to find on a mammogram.
So your first port of call is things you can see, changes you can see, changes that you can feel, making sure that you sign up for the, for the screening program, and then getting advice on whether you should be getting mammograms yearly or biannually.
That's correct. Yeah.
Yeah. Still looks like the moon to me.
You're going with the beautiful bald head and 2 ears. Jackie, you've been an absolute star, mate. And I feel I know you that much better.